At this point, they are really hypotheses, so there is really nothing that we can say for certain that this is a aha moment and we know exactly what causes it. But there are some studies that indicate that people do form antibodies to their own tissues. So some of the autoimmune mechanisms have been implicated. We know that virus can persist, and one of the hypotheses is that the virus is lingering in some of the what's called protective sites, such as brain, for example. We can't really detect it with a bloodstream, but sometimes we do find markers of inflammation. And sadly, the studies of patients who have died because of COVID have found a virus in nervous tissue. Whether or not that actually happens in patients who suffer from post-acute sequelae of COVID or long COVID, we don't know. And finally, another hypothesis is there is just so much inflammation that happened during initial illness that it just takes time to resolve. So that's still in the works and still yet to be determined. And I'm hoping there's definitely work happening in this area. So I'm really hopeful that we will find a mechanism and potentially several mechanisms that are at play, and we will understand better how to treat this condition.